Hi, welcome to Success Factors. I'm your host, Brenda, Siri. Let's face it, not everyone loves going to the dentist. I know for me, growing up, I had a really horrible experience at a dentist. And so as an adult, finding an office, finding the right dentist in a place that I felt comfortable was a very difficult decision for me. But I got lucky. I found some fantastic dentists who have joined me on the show today, and I'd like to introduce you to Dr. Haroon and Dr. Khan. Thank you for being on the show.
Thank you for having us.
And thank you for making me feel safe in the dentist office. Dr. Haroon, I know you are a board certified periodontist and implant surgeon. And Dr. Khan, you are a general restorative dentist. And the two of you own 3 implant centers here in the Dallas area. We've got Pixel Dental in McKinney, and we've got Fix Dental in Trophy Club, and then North Texas Family Dental and Implant Center in Sanger. And it's really great that you both took the time away from your very busy practice to be here with me today. Thank you.
Well, it's an honor.
Thank you.
Thank you for having us again.
I know you're currently in the process of rebranding and consolidating the brands of the dental centers that you have. Can you tell our viewers a little bit about what's going on there?
So basically what we're doing is right now we started Pixel Dental and, we have Fixed Dental, but we wanted all the practices to be on the same operating system, kind of have the same flow, same patient experience. So what we're doing is in the process of rebranding, basically, Fixed Dental and Implant Center is, I think, what defines us as a practice, because we do a lot of fixed implant restorations or implant supported teeth that don't come out. So hence we came up with a new name, and we're just going to change the name for the other practices slowly but surely, and then make sure that all the practices have the same name, logo, and basically the staff is also aligned in all 3 practices, and that's what the plan is in the coming months, very soon.
Good. That's exciting. And that's a lot of work really to get that across the board, but I'm glad you're doing that because I think the consistency is really good. Right?
Oh yeah. I mean, to be honest, it's a lot of fun for us, the processes, and I'm very proud of what we do, and we're at a point where I just want to replicate the same process. I think we have a good process, a good flow. Our patients have a really good experience. So being able to replicate that is the next step. I think that's where the mastery is.
Yeah, absolutely. Yeah. Dr. Haroon, you have gone far beyond traditional dental training, completing advanced residency and fellowship programs in periodontics. What does that mean? And how does that training change the outcome to your patients?
So what I did was after dental school, I went for 3 years of residency training. And that's basically specialty training that's focused to placing implants, implant surgeries, treatment of implant conditions, bone grafting. So my primary focus is treating patients that need implants or even regenerating and regrowing bone. And it gives me the residency training basically gave me the background and knowledge to treat those advanced cases for patients and give them more implant solutions that they typically don't get at a general dentist's office. The other advantage that I had at my residency training program was I went through anesthesia training at the hospital. So that allows us to offer various levels of sedation for our patients. And, dentistry and anxiety go hand in hand. So it allows us to kind of help patients in both ways.
That's great.
Yeah.
And Dr. Khan, how does your specialization differ from Dr. Haroon's, and how do you two work together?
So I'm a general dentist, kind of similar to a PCP physician. I do crowns, bridges, fillings. And my job is to look at the patients on a holistic level. So I'm looking at patients, I'm looking at their overall health, I'm looking at what medications they're taking, I'm looking at any conditions that could affect their oral health and determining what the right approach is. For some people, it's crowns, bridges, and veneers. For some people, it's a full mouth restoration and implants. And so it's a matter of matching the patient to the right treatment and executing that.
It's interesting. I had a person who worked for me many years ago, and she had had open heart surgery. And she had had open heart surgery because of a dental issue that was mistreated, and the doctor didn't take the time to understand all of her health conditions and how bad that tooth was, did not have her take antibiotics before, and she ended up having a heart attack and having to have major surgery. So I understand what you just said. It's more than just a tooth. I mean, your teeth affect your body, right?
I think the other thing is that restorative dentists, sometimes patients don't understand, but they're actually one of the most important people, because they're kind of like the liaison between different specialties and recognizing a problem and then pointing the patient in the right direction, diagnosing that, and then collaborating with different specialties to give the patient the best outcome is what I think his expertise is.
Yeah, it's not just a matter of having beautiful teeth or having a beautiful smile. Sometimes people don't think about it, but the head is connected to the rest of your body. And a lot of what's going on in your body can show up in your mouth. For example, acid reflux or GERD. I'll see it in the mouth way before, I'll look at their teeth and say, do you have any acid reflux? And they're like, yeah, I do. I said, yeah, well, you have some pits on these teeth. I see that maybe you need to go see a GI doctor. Or, a patient may say, hey, I'm brushing 3 times a day and I'm still getting cavities. And so we'll kind of look at, do they have dry mouth? Do they have any conditions that may be contributing to their oral health? So I think oral health is important, and helping senior dentists is
super important. Yeah, absolutely. And you guys definitely have done a great job of making the experience of coming to a dentist's office certainly better. We're going to talk about that. Just going and getting a filling or a crown can be traumatic for people, but a lot of your patients undergo really complex implant surgery. So how have you designed your practice to help eliminate that fear?
I think we do it 2 ways. One way is, I think people have a fear of unknown, right? When somebody doesn't know what's going to happen to them, they're fearful. So one of the things that myself and all the doctors do at our practice is educating the patient really well about what the procedure is, or what the problem is, what the procedure is, how long the procedure is going to take, and what outcome we're expecting. So we're educating the patient thoroughly about the process. That, I think, it helps alleviate some of it. And to supplement that, we do offer different forms of sedation based on the patient's health history and the procedure that we're performing on them. So we kind of try to manage both aspects of it. But really, I think it's the communication aspect of it that does more and goes a really long way than anything else.
Absolutely. I mean, you want to know what to expect, right? And Dr. Khan, walking into your office, it's actually sort of a fun atmosphere, right?
Yeah.
Do you think that helps alleviate some of that anxiety in patients, the music, the smell, the decor?
100,000%. I think the team, just the whole atmosphere, the vibe and the culture makes a huge difference. And
we try to make it a point that we don't, a dental office doesn't smell and sound like a dental office. So that was one of my big things. Yeah. And I mean, we try to do that.
You're successful. It's true. Okay. A question I've always wanted to know, though, you guys have some like sugary snacks in there for people that are waiting.
It's good for business.
Is that what it is? I always wondered the first time I came in, and I was like, wait, there's Cokes and candy bars and chips. So, okay, it's a business thing.
It's rewarding too, right? Rewarding the patient, or sometimes we have patients that have kids, so they can grab a snack or something.
I love it. I mean, I think it just adds to the comfort, right?
Yeah.
So what type of sedation options do you offer to people? I would assume there are different levels of need for each patient and what procedure they're having, but what do we got? Do we got the funny gas? What do you offer?
100,000%. We have different levels. So the basic one is nitrous, which is a gas that kind of just makes you feel a little bit relaxed. You can have a pill which is called oral sedation.
Mhm.
We do IV sedation, and all the way up to full-blown general anesthesia with an anesthesiologist. My practice philosophy is just, I want to make sure you're comfortable.
Mhm.
So you're always in the driver's seat. If all we get accomplished is getting you in the chair and using a mirror and doing an exam, that's a win for me.
Yeah.
So even though we may be booked out for 3 or 4 fillings or 3 or 4 crowns, if you're not feeling comfortable or that level of sedation is not good, at any point we can stop, we can reschedule, and do it with a different type of sedation. We never want to traumatize a patient or do things that they're not comfortable with.
I appreciate that because I've been in dental chairs where I wish the dentist would have said, we can stop and take a different route. And I think that, shows me it's not just that you guys are professionals and have the right certifications, but you've got the right heart, for your patients. And that's huge.
I think it's just paying attention to the patient too, right?
Yeah.
What are they white knuckled, like grabbing the chair really
Right.
tightly, or what is their body language, and just paying attention and just checking in and saying, how you doing? Are you
Yeah.
okay? Do you need a break?
Yeah.
Do you want to do this a different day? Are you tired? It's okay,
The human aspect of it, yeah.
Yeah, absolutely. Patients often hear terms like implants, crowns, bridges, and full arch restoration and can feel a little bit overwhelmed. So can you help explain the difference of what a full arch restoration is in simple terms?
Yeah. So a full arch restoration can be 2 different things. One is a full arch restoration that is composed of just crowns and bridges. A crown is basically a cap that goes on a tooth and embraces the tooth, versus the other form of a full arch restoration is doing implants on both top and bottom. So these patients get a fixed set of teeth supported by implants that don't come out, or the other option is to do snap-on dentures, which are also supported by implants. So those are the different types of full arch restorations.
And what's the recovery time on having, either I guess even the crowns and bridges have some downtime with them, but if you had to have the full upper and lower pop in, snap in,
Right.
or implanted
So
arches.
yeah, so typically I would tell with the crowns and bridges, the recovery is a lot faster because we're not placing implants into the jawbone. But when it comes to doing implants or a full mouth of implants, then typically I tell my patients the discomfort will be the first 3 to 4 days, and then the swelling kind of tapers down. It's very subjective too, because there's some patients who have a little bit more of a post-operative discomfort than others, including myself. I'm actually one of the very slow healers that I know. So while there is a subjective aspect to it, objectively, typically, the first 3 to 4 days are the hardest days, and then it kind of starts to taper down.
Yeah. How does it change a person's life, do you think?
I think doing full arch restorations is probably one of the most rewarding things that you can do. Oftentimes we will see patients come in and they're scared, they're nervous. We have Kleenex in every room because we always have somebody emotional in our office.
Right.
Scared, nervous. They're so embarrassed. They can't, they're single, they can't ask for a date, they don't go out. And after the surgery, we'll see them for their follow-up. Their whole demeanor has changed. The way they carry themselves, the clothing, their hair is done, they're beaming. And it's just such a rewarding thing to be able to have a part or be able to have made that little bit of a difference in somebody's life.
Sure.
I think
the second aspect to that is also the health aspect of it, right? Patients who have a lot of decay or gum disease, it's also affecting their overall, like we touched base on this earlier, it's affecting their cardiovascular health, it's affecting diabetes and other aspects of it. So I would say it also improves their overall health and their ability to eat simple things like a salad.
Right. So from a long-term financial and health perspective, how do dental implants actually compare to alternatives like crowns and bridges or veneers?
So I think financially, if this that's the right financial decision for somebody, I really can't comment on that.
Right.
But from the health aspect of it, it's very it's on a case by case basis. So the younger patient, we obviously try to save as many teeth as possible. But if we're at a certain point where they have cavities underneath every crown and we've tried every other avenue, then the better financial and health decision would be to get implants, because implants don't get decay. So I think it's very subjective, and it's based on the patient, their age, health factors. So a lot of factors have to be considered. But overall, I think it provides a good solution to people who have teeth that are failing and can't be restored. At least 60 to 70% of their teeth are failing. It would be the right decision for them.
Yeah. So I want to show some slides here of your patients. There are before and after pictures. These are full arch replacements. So this is where they have done upper and lower. So this is our first example. Obviously, he did not have 60 to 70% of his teeth that were in good shape, it looks like.
Yeah. So a very interesting guy. He actually works at a golf course, and he had teeth where he had a lot of periodontal disease, loose teeth, mobile teeth, and it was really affecting his confidence and, more importantly, his relationship with his girlfriend. So they both came in together, and as you can see, he's a handsome dude.
Very handsome.
So
doesn't even look like the same person, really.
Yeah.
By the way, he is the same person. This isn't two different people.
Yeah.
But here we have another patient who was in dentures, and the dentures didn't fit. She was in dentures for probably 20 years. And there were a lot of other dentists who told her that they are not able to do implants on her. Because of our training and because implants is our specialty and we work as a multidisciplinary team approach, we were able to give her a fixed set of teeth supported by implants on the same day. And, she also looks like a different person because just the lip support and just makes her look younger as well.
Absolutely.
And that patient, Gary, he actually came with his mom, and it was his teeth were affecting his confidence, his ability to eat, most importantly, his ability to get a job. And so it came with his mom, and we were able to do fixed implants for him, give him teeth the same day. And, you can just tell like there's a huge difference in just the personality. I mean, even though pictures don't say much about a person, but they do. And not words.
It's just not teeth. It changes their whole life.
Absolutely.
The way they carry themselves, the way they walk in the door, it's just, they're a whole new person.
Right. And I think we've got one more to show.
Yeah. I remember her actually very well. She came with her daughter, and she had a lot of loose teeth, and she was very embarrassed. She said that at events and at holidays it's hard for her to eat, so it was really about function and quality of life for her. We were able to do the same procedure, give her a fixed set of teeth supported by implants the same day, and was very happy.
And her teeth look so natural. They look amazing. Yeah, that's amazing. So you talked a little bit about these people being able to go home the same day with teeth, and I see ads all the time, come in, you can go home with a new smile in one day. So with full arch treatments, because I always watch those commercials and think, are they leaving with dentures? What's going on? So how is it possible with the procedure that you do that people get to go home in one day with a new set of teeth?
I always like to give the analogy of a table. When a table has 4 legs, you're able to put a tabletop on it because there's multiple points of support. So the procedure back in the day was known as an all-on-4 because 4 is the minimum number of implants needed to give you a fixed set of teeth the same day. But in our practice, whatever is necessary to make the treatment successful for you, whether it's 4 or 6, we're going to go ahead and do that because we want to ensure that every patient goes home with that fixed set of teeth. But really the concept is having multiple points of anchorage and support so you can put those fixed set of teeth on those implants the same day.
It's amazing. How do you help patients decide which implant solution is right for them, both from a medical and financial standpoint? I know we talked a little bit earlier about age being one of the factors, but I would assume that you have to sit down and have these conversations with your patients, right?
Yeah. I think again, I've never considered finances when it comes to picking a treatment plan for a patient. It's really about the right treatment option for the right patient. And the factors that we consider are the age of the patient, the rate of decay. There's some people who are just prone to having more tooth decay versus there's some people who are prone to having more bone loss. So both of those are different categories, and those patients typically are candidates for dental implants. But I would say that the age of the patient does play a big factor, because typically implants are considered as a last resort option when we've done everything else possibly, and now the teeth are in a state where we can't restore them functionally, or we can't grow bone around them if they've lost some bone. So and then obviously the health of the patient as well, medical conditions are some of the factors that we consider.
Dr. Khan, I know you do more of the crowns and the fillings and veneers. Are veneers a good option, alternative to implants?
It depends on the patient. Whenever we're placing any sort of restoration on a tooth, we want to analyze how strong or stable this tooth is within the bone. Similar to building anything like a house, or you want to make sure the foundation is strong. If the tooth is mobile or it's not in the right place, you don't want to put a veneer or crown on it, because it's not going to last. So you're going to spend a lot of money on something that's going to, in a few years, it's going to come up. It's going to fall apart.
Yeah.
So looking at things comprehensively, looking at the bone, and if this tooth is going to be stable is the things that we just consider when we decide whether to do crowns, bridges, or veneers. And if we can't, then we have Dr. Haroon as part of our team that we can do implants at the same time as well.
So I think in the last week, in my Facebook feed,
of course,
there has been a pop-up, and I think it's a famous actor. I can't think of who it is. Howie Mandel, I think, is who it is. Advertising pop-on veneers. So are these actually viable options for people, or do they end up creating more of a problem than not?
So I've seen some of those advertisements for pop-on veneers. I would be extremely wary of anything that is not supervised by a dentist. A veneer is kind of like a nail. Get these acrylic nails put on. And we want to make sure that whatever we're putting these veneers on, the tooth is healthy. There's no decay. The gums are healthy. If we put a veneer on something that you have cavities or what I call termites underneath, those are just going to continue to grow, and it's going to create a bigger problem. So don't buy anything online. Don't do anything yourself. Don't make anything in the kitchen. Always get it supervised by a dentist. Get a set of radiographs and make sure that we're not covering up a problem. Cavities always get bigger. They're like termites. And the bigger they get, the more expensive they're going to get. So you want to deal with them when they're small.
Okay, so these pop-on veneers in these ads, they're not being made by dentists. They're not endorsed by the American Dental Association.
No, not at all. No, not at all.
Okay. I didn't know for sure, honestly.
It's like
I never
a
thought about
glue-on
it.
nail.
Yes, for
You
sure.
don't know what's underneath.
That's for sure. So like me, I'm sure you have patients that come to you who have avoided going to the dentist for several years. My problem was so bad, I would walk into a dentist office, and before I even saw a dentist, I would just start crying in the lobby. I mean, I had a very traumatic experience. So what is your approach when you get someone like me? I mean, what do you think is your secret magic potion to get them to trust you so they'll come back?
I think one of the biggest thing is that, number one, I'm never going to diagnose a patient's finances, right? I'm always going to tell the patients the right thing. Something that I would do on a family member is what And I would educate them about the process and the procedure, and they're never pressed to make a decision on the same day. They can go home with that information or choose to go for another consult. I'm totally open to that. I'm okay with that. So I think sometimes what a lot of dentists forget is that the patients are people. They're not patients, but they're people who are very afraid. I've been in a dental chair myself. I've had surgery myself. So I can say with certainty that being in a dental chair is very daunting. It's because you feel like you're in an enclosure and you can't get out. So I think one of some of the things start with the lobby and the way we've designed it and the way we've trained our staff to treat our patients as people first and then patients second, but then really educating them about the process. And it is okay if people leave, because 99% of our patients would not make a decision the same day, which is fine, which is okay. It's a major thing. It's scary. You gotta think about it and process it. And so we're okay with that.
But for me, Dr. Haroon, you know, and I don't know if I don't think I'm the only person in the world this has happened to. I was abused by a dentist, and it's sad to think that there are dentists out there who abuse patients, but they do. So how do you overcome that type of patient that comes in the door, where it's not the fear of the needle or the cost of a crown, but it's a true deep-seated fear? What's different about your approach?
For me, it's number one, just getting to know the patient. So when I walk into a room, I usually like to start off with something other than dentistry. Tell me about your hobbies. Tell me about what do you like to do. And it's a matter of taking some time to get to know your patient. How do you feel? How do you feel about this? Watching their body language. Are they tensed? What does their pupils look like? What do their eyes look like? And if they tell me that, hey, I had this bad experience, I want to know more. Tell me what you're afraid of. Is it sitting in this chair? Is it the needle? Is it the mirror? Would it help you if I told you what I was doing? Or do you not want to know what I'm doing? Just finding those little pieces of information and getting to know your patient and making sure that you are taking steps to not trigger their anxiety and establishing that rapport. You know, we have several patients that were so fearful that the first 1 or 2 times they may have needed sedation. But after one or 2 times, you develop that rapport. Their follow-up visits, they're fine. They're normal. They're, just a normal person. You can't tell that they were that fearful. So again, just getting to know your patients, asking the right questions, building rapport, and just being somebody that they can trust.
Right. So. Absolutely. So there are advertisements all over TV, all over the internet about implant centers and, what they can do for their patients. So what do you think anyone should understand before they go into a dental office and have to have an implant surgery performed?
I think it's important to go to a practice that has multiple specialties involved. Periodontist being one of them, or an oral surgeon. Prosthodontist is another one, or even general dentist. There's a lot of corporate chains out there that implants is all they do. And there's a saying that says, when you're a hammer, everything is a nail. Right? So if that's all you offer, or that's all you do, then everybody is a full arch all on 4. At our practice, we have multiple different doctors, and we review all of our cases as a team together. And we're always looking at things and saying, what's the best option for this patient, whether it's a crown, bridge, implants. And so picking a practice that has multiple specialties. You also want to find a practice that has a lab, offers anesthesia, and
you have access to your doctor. A lot of, all of our patients have our personal phone numbers. So if there were an emergency, they can call or text us, and it's not something that that bothers us at all, because at the end of the day, I'm providing a service to people, and truly from the bottom of our hearts, it makes us happy, right? To provide that service. So just going that little extra mile to have that personal connection with the patient, I think that helps also.
Yeah, I can honestly say you are the first dentist whose cell phone number I have ever had in my phone. So, and I appreciate that. You know, it's kind of an extra level of trust for me, you know, so it's great that you do that. Are there any patients that you ever turn away from implant treatment? And if so, why?
Yeah.
Actually, yes. Not everybody is a great candidate for implants. Actually, quite recently, I had a 32-year-old male, and he saw online all on 4 implants, teeth in a day, and he was like, I want to get this done. And I looked at him and I said, you need braces.
Oh, wow.
You know, your teeth are perfectly healthy. You're fine.
Yeah.
All on 4 is not the right treatment approach for you. And this is what you should do. So we do that all the time. It's just matching the right treatment to the right patient.
Yeah, because braces would be a lot more easy to get through, right?
Yeah.
What technology or planning methods do you use to significantly improve precise outcomes for your patients?
So we have many different things. We start with a CT scan. So a CT scan allows us to look in 3 dimensions, look at the bone, look at the bone density, look at any areas of infection, essentially plan our surgery virtually before we go in and do the surgery. We also have digital scanners. So everything that we do is digital in the office. We don't really take physical impressions anymore. So I think that adds an extra layer of comfort for the patient, but it's also more precise. And then we also have photogrammetry. And I know it sounds like a very fancy term, but photogrammetry essentially is now we scan the implants. So scanning the implants allows us not only to instantaneously get the most accurate position, but it dramatically improves the outcome for the patient because not everything fits very precisely. And I think you had a really good example.
It's kind of like everything in our office is digital, and it allows things to happen really fast. In the old days, we would write a letter and we would send it in the mail, and somebody would get it and open it. Now you would never even think about doing that. You just send an email, a text, or whatnot. And so our office is fully digital. All of our equipment is not only digital, but it's top of the line. It's the latest and greatest that's available in the market. And we really pride on having the latest and greatest of everything because we want our patient outcomes to be the best. We want to take photos of it and we want to show it off to people and show off our work.
I know the digital impression thing sold me right away because those old ones that they'd stick in your mouth and you'd have to wait and pry it out, that used to really freak me out. Yes, I like your latest and greatest technology for sure. So if a patient's been told they're not a candidate for implants or have received an extremely high quote for services, what would you tell them?
Come see us.
Right? Come on.
I think, again, there's 2 aspects of it. One is that, they went to a dental office where maybe they weren't the experts in the procedure. Ever since we've had our practice, or ever since I have been practicing, I've not seen one patient where we haven't been able to place implants on that patient. So I think there's always a solution. There's just some people who are experts in it and some not. We don't charge for second opinions. So, the patients are welcome to come to our office, and not every treatment plan is created equal either. So if a patient got a code for implants at one practice, it may be a completely different treatment option versus another option that we're offering. So it's important to be able to compare those. So I encourage our patients to even bring those treatment plans so we can compare apples to apples.
Sure, makes sense. So Dr. Haroon, you were recognized by Incisal Edge magazine as one of the top 40 specialists in the country in the United States under the age of 40 in your specialization. What does that recognition mean to you professionally?
I think more so than anything, I think it's just humbling, right? I'm very blessed to be in that position, but it just humbles me and, just encourages me to continue to learn and, invest and get better at what I do. And also at the same time, build the right team that can support that process and procedure. So I'm just very grateful.
Good. Well, congratulations on that.
Thank
That's
you.
huge. That's
Thank
really
you.
big. So for viewers watching today who want to learn more, schedule a consultation, or come see you for a second opinion, we have a slide that is going to be shown to our viewers with information on all three of your centers, the McKinney, Sanger, and Trophy Club. And they can reach out to you either by phone, by your website addresses, and schedule time in a location that is near their home base, I would assume, right?
Yeah.
Well, I know how busy you both are, and I want to thank you so much, for making me feel comfortable about going to the dentist, because that was a big challenge for me. So thank you for truly having the heart and compassion that you have as dentists, to make it for someone like me to be able to have a healthy mouth again, and just taking time away from your patients and your schedule to be here with me today. I really appreciate it.
Thank you.
Thank you so much for having
The
us.
pleasure is ours. But it's always an honor to be honored by a patient, because that means we truly did the right
You did
thing.
good,
So
kids.
yeah.
Yes, you did. Thank you.
Thank you for
appreciate
having us.
you.
Yeah.
Well, that's it today for Success Factors. Don't be afraid to go to the dentist. It's important for your health. So we'll see you next time on Success Factors. Bye.